Cases of norovirus are continuing to spread across San Diego County and the U.S., and doctors are seeing an increase in patients coming to the ER to be treated for symptoms. Dr. Nick Sadi is an emergency medicine doctor at Sharp Memorial Hospital. How are you doing today, Dr. Sadi?
I'm doing well, thank you.
Thanks for joining us. I'll start you off with a softball question. Explain to our viewers what norovirus is and how it spreads.
So norovirus is a highly contagious seasonal virus. It's very contagious. It spreads in a number of ways. Most often it's going to spread through vomit, oral secretions, can spread through contaminated food and contaminated water as well, but notorious for being very, very contagious.
Okay, so what symptoms are there for it, and at what point do I need to come see you if I'm feeling some of these symptoms?
Well, like any virus, there's going to be systemic symptoms. You know, you're going to feel sick with low energy levels and body aches and some chills. But a virus like norovirus is going to make its home in the gastrointestinal tract. So there's going to be a lot of those GI symptoms like abdominal pain with cramping, as well as lots of vomiting and diarrhea. So that combination, obviously very uncomfortable to go through, but when you have both vomiting and diarrhea, it can make you very prone to dehydration. So when you're looking at when to seek care, it's going to be when you're worried that you can't keep up with those losses, too much vomiting and diarrhea, and you're worried about getting very dehydrated, low energy levels, feeling weak and faint, things like that.
Right, so I'm drinking water, it's not working, so now I come see you. What do you all do? How is it treated?
Well, first and foremost, one of the most important reasons to seek care is to actually make sure that's all that's going on. A lot of times people will try to maybe self-diagnose, oh, I have food poisoning or the stomach flu, but when we evaluate you, we might find some clues, signs, and symptoms of like an alternative diagnosis, so that's a very good reason to seek care as well. But when it comes to treating the symptoms of norovirus, it's going to be a lot of supportive care. So there's not any kind of specific treatment for the virus, but since the symptoms can be very intense and distressful and put certain patients at risk, we're going to be focusing a lot on those symptoms. So there's IV fluid, rehydration, nausea medications, and pain medication. That's usually the mainstay of treatment for norovirus. And other viruses like that cause a gastroenteritis. That's our medical term for any virus that really infects the GI tract.
Dr. Sadi, Sharp Memorial Hospital, we appreciate your time. Thank you.